Riddle me this. What is the best hello and the hardest goodbye? Your bed. Well, with the bed comes sleep. But unfortunately for some people, sleep apnea has taken a detrimental toll on their health and their blissful sleep. And sleep apnea can also be potentially fatal. So according to Sleep and Breathing, a study conducted on 777 college students, they have concluded that there's a low prevalence of high-risk OSA, which is obstructive sleep apnea, among young university students, and it also is consistent with their assumption that in general the young population is also at low risk of sleep apnea, but it also increases with advancing age in both men and women. So although it is reassuring that we are not prone to sleep apnea, it's something to be aware about, especially since we're always aging. So what is sleep apnea, you may be asking? Sleep apnea, as stated by the National Heart, Lung, and Blood Institute, is sleep when the upper airway becomes blocked repeatedly during the night and reduces or completely stops airflow. So there are 3 different types of sleep apnea. There's obstructive sleep apnea, central sleep apnea, and mixed sleep apnea. Obstructive sleep apnea is when there's like muscle relaxation and your tongue and your tonsil completely fall back during your sleep and completely block the airflow of oxygen. Central sleep apnea is when there's no blockage, but your brain thinks it's being blocked, so essentially you forget to breathe during the night. And a mixed sleep apnea is a combination of both obstructive and central sleep apnea. So according to the American Sleep Apnea Association, obstructive sleep apnea, often called OSA, is the most common among people. People with untreated sleep apnea stop breathing repeatedly during their sleep, sometimes hundreds of times and often for a minute or longer. So as seen here, this is a normal person without sleep apnea, and on the right side we see a person with sleep apnea. And as I mentioned earlier, sleep apnea is when the uvula, something in the back of our neck that wiggles, and then the tongue falls too far back and it literally blocks the flow of oxygen to your lungs. So as stated by the Journal of American Medical Association, it is estimated that over 12 million individuals in the United States have sleep apnea. Some of the causes of sleep apnea include obesity, and that's because due to the increase in fat deposits near the neck area that can block the airflow. Age, loss in muscle tone due to aging can cause it, and it also increases for women after menopause. Gender can also play a factor. According to the Mayo Clinic, men are 2 to 3 times more likely than women to have sleep apnea, and however, it also increases in women if they become overweight. Other factors of sleep apnea include alcohol and smoking. It could also be genetic. For example, if someone was born with large tonsils, that could potentially lead to sleep apnea. Some symptoms and signs of sleep apnea include snoring, gasping for air during sleep, drowsiness, headaches, difficulty concentrating during the day, waking up with a dry mouth, and chest pains. In an article I read by the New England Journal of Medicine, it was about a 61-year-old man who was feeling these symptoms that I have previously mentioned, such as snoring, drowsiness during the day, and obesity. It was concluded that he had sleep apnea, and the doctors treated him with a medical machine called continuous positive airway pressure, which I'll explain later. But this essentially reduced his drowsiness and improved his alertness. Some of the long-term effects of sleep apnea include high blood pressure, heart attack, stroke, heart disease, and irregular heartbeats. Luckily, there are treatments for sleep apnea, which include losing weight, the way your sleeping position. So, say you sleep on your back, by sleeping on your side has been proven to help with that. Reducing smoking and alcohol usage. And as I mentioned earlier, one of the most common applications or treatments for sleep apnea is the continuous positive airway pressure, or the CPAP machine, which it looks like this, and it's essentially a machine pumps pressurized air through a tube into a mask. It can be either just through your nose, or you have the option of having it over your nose and mouth, and it essentially pushes air through you to keep the airway open, so you have a more relaxing, better sleep. And according to the Journal of the American College of Cardiology, it is evident that early CPAP therapy has positive effects on the long-term survival in ischemic stroke patients with moderate to severe OSA. So now I would like to take a moment for us to appreciate how lucky we are just to be able to sleep, because yes, I know that as college students we have schoolwork and extracurricular activities that keep us up at night, but once we actually get into bed, we can just go to sleep and sleep peacefully and sleep. Whereas other people are suffering with sleep apnea. And it's also important for us to keep our bodies healthy by eating the right foods and exercising daily. And if you feel any of these symptoms, it's important to consult a doctor, because these could lead to negative consequences down the line. So, and it's better to be safe rather than sorry.